Sure, let's conduct a deep dive into pharmacology, expanding on key areas with more detail, examples, and clinical relevance. Comprehensive pharmacology, a deep dive. Pharmacology studies how drugs interact with biological systems, focusing on their effects, mechanisms of action, therapeutic uses, and toxicology. It encompasses various disciplines, including chemistry, biology, and medicine. Key concepts in pharmacology: absorption, mechanisms of absorption, passive diffusion, movement from high to low concentration without energy. Lipid-soluble drugs diffuse easily across cell membranes. Facilitated diffusion involves carrier proteins, no energy is required, important for hydrophilic drugs. Active transport requires energy to move drugs against their concentration gradient, like glucose transport. Endocytosis, used by larger molecules, cells engulf the drug, allowing it to enter. Factors influencing absorption: route of administration. Different routes such as oral, IV, IM, South Carolina have different absorption rates and bioavailability. Drug formulation: liquid formulations generally absorb faster than tablets or capsules. Gastric pH affects drug solubility and ionization. Weak acids are better absorbed in acidic environments like the stomach, while weak bases are better absorbed in alkaline conditions such as the intestines. Gastrointestinal motility: faster transit times can reduce absorption, while slower transit can enhance it. Distribution. Volume of distribution, or VD, indicates how extensively a drug disperses throughout body tissues compared to the plasma. A high VDT suggests extensive tissue binding, like lipid-soluble drugs. On the other hand, a low VD indicates limited distribution, such as drugs that bind extensively to plasma proteins. Factors affecting distribution include blood flow, where organs with high blood flow, like the liver and kidneys, receive drugs quickly, while fat tissues receive drugs more slowly. Tissue binding is another factor. Some drugs may accumulate in specific tissues, such as tetracyclines in bones and teeth. Finally, protein binding plays a role. Drugs can bind to plasma proteins like albumin, but only free or unbound drug is active and can exert effects. Metabolism. Phase 1 reactions involve the modification of the drug's chemical structure through processes like oxidation, reduction, or hydrolysis. These reactions are mediated primarily by cytochrome P450 or CYP enzymes. An example is the conversion of codeine to its active form, morphine, via CYP2D6. Phase 2 reactions involve conjugation reactions that increase water solubility, making drugs easier to excrete. Common conjugation reactions include glucuronidation, sulfation, and acetylation. For instance, morphine is glucuronidated to form the inactive morphine-3 glucuronide. Factors influencing metabolism include age, as infants and the elderly often have reduced metabolic capacity. Genetics also play a role. Genetic polymorphisms in metabolizing enzymes can lead to variations in drug metabolism. For example, individuals with CYP2C19 polymorphisms may metabolize clopidogrel differently. Drug interactions are another factor, as some drugs can inhibit or induce metabolic enzymes, affecting the metabolism of co-administered drugs. A common example is grapefruit juice, which inhibits CYP3A4. Excretion. Renal excretion is the major route of elimination for water-soluble drugs and metabolites. This process involves filtration, reabsorption, and secretion. Filtration occurs in the glomerulus, where free drugs and metabolites are filtered from the blood. Secretion involves active transport processes that can further eliminate drugs from the blood into the renal tubules. Reabsorption can occur for lipid-soluble drugs, which may be reabsorbed back into the bloodstream. Biliary excretion is another route where drugs or their metabolites can be secreted into bile and eliminated with feces. This route is particularly important for drugs that undergo extensive hepatic metabolism. For example, digoxin can be excreted via bile in its unchanged form. Pharmacodynamics studies the effects of drugs on biological systems, focusing on their mechanisms of action and therapeutic effects. Let's dive into the mechanism of action. Receptors. Drugs produce effects by interacting with specific receptors. Receptors can be classified into several types. G-protein-coupled receptors, or GPCRs, mediate responses through second messengers like CAMP and calcium. They play a role in a wide range of physiological processes. Ion channels. Drugs can activate or inhibit ion channels, leading to rapid effects. For example, local anesthetics block sodium channels. Enzymes. Some drugs inhibit specific enzymes. For instance, statins inhibit HMG-CoA reductase, which helps in lowering cholesterol. And lastly, nuclear receptors. These regulate gene expression in response to hormones like steroid receptors. The dose-response relationship is crucial in understanding how a drug works. Let's talk about the graded dose-response curve. The graded dose-response curve illustrates the relationship between drug dose and effect. It helps determine the potency and efficacy of a drug. Potency refers to the amount of drug needed to produce a specific effect. A more potent drug requires a lower dose to achieve the same effect. Efficacy, on the other hand, is the maximum effect a drug can produce regardless of dose. Drugs can be equally potent but differ in efficacy. The therapeutic index is a key concept in pharmacology. It's defined as the ratio of the toxic dose, or TD50, to the effective dose, or ED50. A higher therapeutic index indicates a safer drug. Clinically, this is very relevant. Drugs with a narrow therapeutic index, like warfarin, require careful monitoring to prevent toxicity. Drug classifications can be quite diverse, but let's break them down step by step. First, we can classify drugs by their source. Natural drugs are derived from plants, animals, or minerals. For example, morphine is derived from the opium poppy and is used for pain relief. Another example is quinine, which is extracted from cinchona bark and used to treat malaria. Synthetic drugs, on the other hand, are chemically manufactured. Aspirin is a well-known synthetic drug synthesized from salicylic acid and used as an analgesic and anti-inflammatory. Ibuprofen is another synthetic drug, commonly known as a non-steroidal anti-inflammatory drug, or NSAID. Then we have biologics, which are derived from living organisms. Insulin, produced through recombinant DNA technology, is used for diabetes management. Monoclonal antibodies like trastuzumab target specific antigens such as HER2-positive breast cancer. Another way to classify drugs is by their mechanism of action. Agonists are drugs that activate receptors to elicit a biological response. For instance, morphine acts as an agonist at mu-opioid receptors, providing analgesia. Antagonists, however, block receptor activity without activating them. A good example is naloxone, an opioid receptor antagonist used to reverse opioid overdose. Lastly, we have enzyme inhibitors, which inhibit specific enzymatic reactions. ACE inhibitors, like lisinopril, lower blood pressure by inhibiting the angiotensin-converting enzyme. Routes of administration, oral or PO, is convenient, non-invasive, and suitable for self-administration. However, it has disadvantages like variable absorption due to first-pass metabolism and food interactions. Intravenous, or IV, offers rapid onset, 100% bioavailability, and precise control over drug levels. But it is invasive, carries a risk of infection, and requires trained personnel for administration. Intramuscular, or IM, is suitable for depot formulations for sustained release, though it can cause pain at the injection site and has variable absorption based on blood flow. Subcutaneous, or SC, can be self-administered and has slower absorption than IV or IM, but the volume that can be administered is limited. Topical and transdermal routes also have their uses. Topical allows for direct application for localized effects, such as hydrocortisone cream. Transdermal provides systemic effects via patches, like fentanyl patches for chronic pain. Clinical pharmacology, therapeutic drug monitoring, or TDM. The purpose of therapeutic drug. Monitoring is to optimize drug therapy by measuring drug concentrations in the blood, ensuring efficacy while minimizing toxicity. It is essential for drugs with narrow therapeutic indices, such as aminoglycosides and digoxin. Pharmacogenomics is the study of how genetic variations affect drug metabolism, efficacy, and toxicity. One of the key applications of pharmacogenomics is in tailored therapies. This involves adjusting drug choice or dosage based on genetic profiles. For example, warfarin dosing considerations are often based on VKRS1 and CYP2C9 genotypes. Another crucial application is in oncology, where targeted therapies are based on tumor genetics. A good example of this is the use of EGFR inhibitors in lung cancer. Adverse drug reactions, or ADRs, are unintended, harmful reactions to medications. There are two main types of ADRs. Type A reactions are predictable and dose-dependent, such as bleeding with anticoagulants. On the other hand, type B reactions are unpredictable and idiosyncratic, like anaphylaxis to penicillin. Let's talk about common drug classes and examples. First up, we have analgesics. NSAIDs work by inhibiting cyclooxygenase or COX enzymes, which reduces prostaglandin synthesis. For instance, ibuprofen is commonly used for pain and inflammation, while naproxen is another NSAID that's effective for arthritis and dysmenorrhea. Opioids, on the other hand, bind to opioid receptors in the central nervous system, altering pain perception and response. Morphine is often considered the gold standard for severe pain, and fentanyl is a potent synthetic opioid used in both anesthesia and pain management. Antibiotics come in various types. Beta-lactams, such as penicillins and cephalosporins, inhibit bacterial cell wall synthesis. Macrolides, like azithromycin, work by inhibiting bacterial protein synthesis. Quinolones, for example, ciprofloxacin, inhibit bacterial DNA gyrase. Antidepressants can be classified into several categories. SSRIs, or selective serotonin reuptake inhibitors, work by selectively inhibiting the reuptake of serotonin, thereby increasing its availability in the synaptic cleft. Fluoxetine is commonly used for depression and anxiety, whereas sertraline is effective for OCD and PTSD. SNRIs, or serotonin norepinephrine reuptake inhibitors, inhibit the reuptake of both serotonin and norepinephrine. Venlafaxine is effective for major depressive disorder and anxiety disorders, and duloxetine is used for both depression and neuropathic pain. Antihypertensives, ACE inhibitors. These drugs work by blocking the conversion of angiotensin 1 to angiotensin 2, which leads to vasodilation. For example, lisinopril is commonly used for hypertension and heart failure, while enalapril is effective for hypertension and renal protection. Beta blockers. These medications block beta-adrenergic receptors, decreasing heart rate and contractility. Metoprolol is often used for hypertension and heart failure, and atenolol is effective for hypertension and angina. Calcium channel blockers. These drugs prevent calcium from entering cells, resulting in vasodilation. Amlodipine is commonly used for hypertension and angina, and diltiazem is effective for hypertension and atrial fibrillation. Antidiabetic medications. Insulin comes in various types, including rapid-acting, long-acting, and premixed formulations, and is used for managing both type 1 and type 2 diabetes. Its mechanism involves facilitating glucose uptake into cells, thereby lowering blood sugar levels. Oral hypoglycemics. Metformin decreases hepatic glucose production and improves insulin sensitivity. Sulfonylureas, like glipizide, stimulate insulin secretion from pancreatic beta cells. Drug interactions. There are different types of interactions, pharmacokinetic interactions. One drug can alter the absorption, distribution, metabolism, or excretion of another drug. For instance, grapefruit juice inhibits CYP3A4, affecting the metabolism of certain statins and increasing their plasma levels. Pharmacodynamic interactions. Drugs with similar or opposing effects can interact. For example, combining sedatives such as benzodiazepines with alcohol can lead to enhanced central nervous system depression. All right, let's dive into the regulatory aspects of drug development. The process is divided into several phases. First, we have preclinical testing, which involves laboratory and animal studies to assess the safety and efficacy of a drug. Then, we move on to clinical trials. Phase 1 focuses on safety and dosage in healthy volunteers. Phase 2 evaluates efficacy and side effects in small patient populations. Phase 3 involves large-scale studies to confirm effectiveness, monitor side effects, and compare the new drug to standard treatments. Finally, Phase 4 is about post-marketing surveillance to monitor long-term effects and safety. Now let's talk about some emerging areas in pharmacology. One of the most exciting developments is in the field of biologics and biosimilars. So what exactly are biologics and biosimilars? Well, biologics are complex products derived from living organisms. On the other hand, biosimilars are highly similar to approved biologics. For example, monoclonal antibodies used in cancer treatment, like trastuzumab for HER2-positive breast cancer, are biologics. Gene therapy involves introducing, removing, or altering genetic material within a patient's cells to treat disease. Applications include genetic disorders, cancer, and some viral infections. Nanomedicine is the application of nanotechnology for drug delivery, diagnostics, and imaging. For example, nanoparticles can deliver chemotherapy directly to tumor sites, minimizing systemic side effects. Ethical considerations in pharmacology include ensuring informed consent where patients understand the risks and benefits of treatments. Another important aspect is equitable access, which addresses disparities in access to medications and healthcare services. Additionally, pharmaceutical marketing can influence prescribing practices and patient care. Pharmacology is a complex and dynamic field that plays a critical role in healthcare. It bridges the gap between scientific research and clinical practice, enabling healthcare professionals to optimize patient care through the safe and effective use of medications. Understanding pharmacology requires knowledge of drug mechanisms, pharmacokinetics, pharmacodynamics, and the clinical implications of drug therapies. As new drugs and technologies emerge, ongoing education and research will continue to shape the future of pharmacology and its applications in medicine. If you have specific areas you would like to explore further or need additional details, please let me know.